when I was still in the hospital practicing, you would tell the family, this is it, and full stop, that's the end of story because I know better. But we don't listen to them. We've stopped. I think we've gotten to a point where we're so busy, we've stopped listening to them and we're just expecting them to listen to us.
Yes, I think this is the very classical manner to perform and to work in medicine, and this is really changing because now the people are informed and they are coming with their vision about the disease and about their complaint. They can ask artificial intelligence, they can ask ChatGPT, they can ask. They can Google the symptom and they come, they said they give you the list of the diagnosis, the possible diagnosis. The situation is it's much harder than before because I remember that our professors, they see that you should not lose time to discuss with the patient. Now it's totally different. Now it's time, it's shared decision. We explain our vision to the patient and we explain how we see the management, and it's the patient who will decide. For example, it's usually a decision for example, we have 2 or 3 options of treatment and we explain to them that we have option 1, then we will have option 2, then we will have option 3. Sometimes the patient refuse and we cannot oblige the patient to accept your decision. You need to convince him. You need to understand what is his situation, why he's refusing, why he's accepting. Sometimes, for example, we in diabetic patient, I give you the example of diabetes is very common situation. It's indication of insulin therapy, but we cannot give them insulin therapy for this simple reason that they have no one. They have severe retinopathy. They almost blind. And they can now not have someone who can inject insulin for them. So this is, if we don't understand the situation, we'll give them insulin and they will not inject it, and they will come back with complications, acute complication. Maybe they will be admitted to ICU, and maybe we can, with the high risk of life-threatening complication, maybe we can lose them because our robust and abnormal decision. It's usually now is changing. It's usually shared medical decision between us, the family, and patient.
Yeah, I think that's how do you think that we should be? I know you said we should tell them what's our vision, what's their vision. Would you say it's a lot of a change in mindset and perception? I mean, years ago, I remember if the patient ever catches you Googling, they'll say, oh, this doctor doesn't know anything, right? But now there's, like you said, ChatGPT and all, they have all the answers and they might be coming and testing you out, maybe. I mean, we don't know, right? So as a doctor, I might feel like, oh, he's probably testing my knowledge. So how do we deal with this as doctors?
I have 2 perspectives because of the patient I was seeing in Tunisia and I'm seeing now in Saudi Arabia. It's different different profiles. Usually in Tunisia, they come with complaint. They can ask, doctor, I have headache and I want your advice. What should I do? In Saudi Arabia, maybe even in Tunisia, it's changed, but recently we come, doctor, please do, I want you to order for me CT brain. And this is very, 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 very horrible because they go directly to investigation. Because when you ask them why you want to do CT brain, they said because I have headache and it doesn't improve. And I have checked it on Google and I have checked it on ChatGPT, and it's explained that it can be tumor, for example, or it can be stroke, or it can be. We are now losing a lot of time to explain to the patient that there is a strategy. For example, for headache, we need to do anamnesis, to do physical examination, and then we will start by the basics of investigation. Then we will go to CT brain or MRI later. It depends on the situation. I think we should not see this as disrespect or as underestimation of our knowledge and skills. But the patient is not an inert uh, uh, individual. He's feeling and he's understanding, and his vision about the disease is different from ours. You cannot imagine, for example, how is awful is his headache. You cannot imagine how many sleepless hours or sleepless nights because of this headache. That's why he's checking and he's calling his friends and he's calling his family and he's asking for a question. Maybe he's during your consultation. Maybe he calls his family doctor. Maybe he calls a friend, a neurologist, and this is sometimes is not very welcome from our side. But we see this very frequently, and they see that they need the best option possible. Maybe you are not the best option, but you are the available option. So they need to look for the best option for them. You need to convince them. Maybe the next time they will not come back to you because you have decided contrary to their because you didn't obey to their orders, and maybe they will accept and they will understand your vision, and this is good for you and for the patient. And I think by this way, we are losing a lot of time, a lot of money, and a lot of people, because this is a very bad approach from the patient. Because if you don't trust the doctor that you are coming to consult, you don't need to consult him. I tell the patient, please don't go from doctor to a doctor. Choose a select one that you trust and that you feel he's trustworthy, and consult with him. Don't go from doctor one to doctor two to it's not normal, because I do the investigation. I don't check them, and you go to the other doctor who will ask for other investigation. I will not check them, and you go to and this is a loss of time, loss of money, and mainly loss of health for the patient.
Mark your calendar for Disruptive Doctors annual conference and exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact.